Mental health, mental illness. What's the difference? Well, there is. And we're going to talk about that today when we go over four terms, mental health terms that women over 40 need to know. And we're going to do that in just one moment. Not yet. I've got to find it. Here we go. Hi there. Welcome to Stress Talk Live with Marcyline. This is the place where we help women over 40 to live healthier lives through strategic stress management and solution focused self care. I'm Marcyline Bailey, and I am your host for this evening. This is Mental Health Awareness Month, and we're going to talk about all month mental health. Just some basic things about mental health. What are some of the differences in the terms? We'll explain some of the terms. We'll also have special guests on Stress Talk Live talking about mental health. Mental health, good mental health, is part of our overall well being. And it's so important to be aware of what helps and what hurts. And that's what we're going to deal with all month as we are what? I won't say celebrating, but as we are advocating, teaching, as well as learning during this month. First of all, as always, excuse me, I'm going to ask you to like, follow, and subscribe to ML Bailey Consultants. Oh, I have a frog in my throat. If you'd like more information about ML Bailey, you can always go to this link right there, that one right there, that also helps you to subscribe. It has a link to subscribe to my newsletter, which went out today, by the way. For those of you who received it, let me know what you think. I added a video giving some background information on Mental Health Awareness Month. So let me know what you think when you receive that newsletter and you have a chance to review it. Also, here's my website. You're welcome to go there. I'd love for you to go there and to just, excuse me, learn a little bit more about me and what ML Bailey Consultants offers. So, what are we talking about today? We are talking about mental health ABCs. And I chose this as an introduction to our participation in Mental Health Awareness Month because so many of us use terms around mental health and mental illness, and we don't really have a good understanding of what those terms mean. Also, for people who are experiencing mental health struggles, or they have family members who are experiencing mental health struggles, it's also very helpful to hear some of these terms, know exactly what they mean, especially when we're talking to a professional, mental health professionals or doctors. Do you go to the hospital, to go to a doctor and you just listen to what the doctor says and you don't ask questions? Well, we want to ask questions because it helps us to understand what's going on with us. This month, as you all know, I've started to expand. Well, I started to expand my private practice several months ago. This last month, I was seeing a number of people, number of people. And so many of them had no idea what to expect. And I believe that that's a deterrent to people seeking support and treatment for through mental health services, because they don't know what to expect. They only know what people around them talk about. They only know what they hear on TV. They only know what what people are saying or what they learned from other people as they were growing up. And I had a lot of feedback from people like, wow, I didn't know, I didn't expect this, or boy, I really feel better. So I wanted to focus again, and as a participant of Mental Health Awareness Month, I wanted to focus on mental health terms today. So we're going to jump right into it. I don't want to belabor the point, but this is what we're talking about. We're decoding important terms for women over 40. Now, are these terms the only for women over 40? No, they're not only for women over 40. However, women over 40, if you are a wife, a mother, a daughter of aging parents, or other aging family members, women tend to be the caregivers. And so, this I hope will help you as we're doing a whole month as participants of Mental Health Awareness Month. I hope this will help you to have an idea of what to do, why you need to make some moves, or why you need to have certain conversations with your family members or your friends, and we're hoping to be a support to you. So we're going to jump right into our talk for today. And also, let me mention this. I will also share resources throughout the month. So make sure that you're watching my social media feeds, as well as watching, if you're signed up for the newsletter, you'll be getting also some additional emails from me all around Mental Health Awareness Month. So here we go. Let's talk about several terms, and I'm going to just move this over here so I can see it. It's my notes, you all. So I can see it and I'm not stumbling. Okay, so we're talking about mental health. And so many people use the term mental health and mental illness interchangeably. But these terms are very different. They're distinct and they're different. And so I'm going to just share with you the differences between mental health and mental illness. And then I'm going to share two additional terms around mental health. Okay, does that work? If you have a comment or if you have a question, please, please, please drop it into the comment section and I will try to respond. Okay, let's talk about mental health. When you hear the term mental health, and when we talk about and we say mental health, we are actually talking about the psychological well-being of a person. We're talking about their mental wellness. It's more it's about health, and it's positive, right? We're also someone who has strong mental health or good mental health or positive mental health are able to cope with their day-to-day stressors. They are able to move through their day, manage their stress. They are productive, and they're able to maintain meaningful relationships. This is pretty vital to have positive, and strong mental health. It's even I've talked about how our mental health is connected to our physical health. It is so important. If we are not physically well, it's going to affect how we are mentally. Also, if we're not mentally well, it will affect how we are physically. There are some diagnoses that people have that causes them to lose their appetite. That's one of the symptoms. They don't have they have no appetite. They just don't want to eat. Likewise, some of the symptoms of certain conditions cause them to overeat and eat too much. So, of course, if you're not eating enough or you're eating too much, it's going to affect your physical health. So just keep in mind that when we're saying mental health and when someone talks about mental health, they're talking about the psychological well being or the mental wellness of an individual. These individuals are going through their lives. They're able to work. They're able to manage their home. They're able to maintain relationships. They get along well with people. That doesn't mean they don't argue or they don't have disagreements, but they're able to bounce back. They are resilient. They don't get down or they're not completely overwhelmed. They're just going through their life. They're just chugging along. Okay. And they have a full range of emotions, mental health, psychological well being. You will also hear the term illness. So, when we're talking about mental illness, we're actually talking about mental disorders. Mental disorders like depression, major depressive disorder, anxiety disorder, post traumatic stress disorder, schizophrenia, bipolar disorder. And there's a wide range of mental illnesses, or mental disorders. Now, the only people who can diagnose mental disorder are trained professionals. That they're clinical individuals like LCSWs, like myself, doctors, psychologists, psychiatrists, all can diagnose. And the diagnosis is based on an international criteria that has been developed. And that criteria has definitely changed over the years. However, there is a set criteria that clinicians look at and consider before they diagnose someone with a mental illness or a mental disorder. So, when we're talking about a mental disorder and we're talking about that criteria that's used to diagnose a mental disorder, we're looking at behavioral or mental patterns that cause significant distress or impairment in the person's ability to function. So I know I in some of the spaces that I'm in, I hear people say, "Oh, they're just so OCD," right? Um, well, there's a criteria that is used to actually diagnose someone with OCD, which is obsessive compulsive disorder. And in order to have that diagnosis, in order to give a person that diagnosis, there's certain behaviors, certain mental patterns that are looked at, and those behaviors and mental patterns must cause significant distress or impairment in their ability to function on a day-to-day basis. When a person has a mental illness or a mental disorder, it disrupts their lives and it adversely impacts their well-being. This is very important because when we say things like I said earlier, like some women say, oh, they're so OCD, or, I'm so OCD, it really gives a false impression about the devastating nature of a mental illness. Now, that is not to say that a person who has a diagnosis of mental illness, or has been diagnosed with a mental illness or a mental disorder. It's not to say that they cannot live um, a natural life. It's not to say that they cannot have a job, they cannot function, they cannot. It's not that. Without treatment, it causes disruption, and it causes significant distress, and it's very difficult for them to function in their job, in their home, and maintain. I would say that when you think about a mental illness, you're actually thinking about an illness, right? You're thinking about an illness. You're thinking about something similar as diabetes, heart disease, a broken toe, broken toe, um, or some chronic high blood pressure, something chronic. A mental illness or a mental disorder responds to treatment. And that's what's very important. That enables people to live their lives in the best way that they can. So again, just because a person has a diagnosed mental illness, it does not mean that they can't function, or they can't hold a job, or they can't be successful, or they can't be highly successful. It doesn't mean that. It just means that it has to be monitored, and they have to receive treatment that is in line with that diagnosis so that they can function to the best of their ability. So we've talked about mental health, and we've talked about mental illness, and we've talked about the differences. I'd like to also introduce you to another term, and that is mental distress. Now, mental distress is when we have like unpleasant feelings or emotions. It's that the experience of stress that we have because of everyday life, right? If you can see the slide that I have up, you can see that the woman in the picture has sticky notes on her face with bills, work, teamwork, shopping, leader, mother, pets, gym, kids, dinner. She is overwhelmed by all of the things that she's having to do and having to manage. Well, mental distress is like that. We can be completely overwhelmed. We can be, wake up and say, oh my gosh, I have so much to do today. We can have an event happen in our lives that throws everything off. The way we move, right? Our routine can be thrown off by something that's distressing. Okay. The thing about feeling distressed and having mental distress is that often we put coping strategies to work. We do what works for us. We may take time out for ourselves. We may take a day off. We may talk to a friend. We may meditate, like I do every morning. We may meditate, but we have coping strategies that we use when we are feeling overwhelmed. These coping strategies help us to get through this period of time that is overwhelming for us. We feel stress, and stress is what I talk about all the time. And we do need stress because stress can be a motivator for us, But it can also, when it gets to a certain point, we can be overwhelmed. We're not burned out yet, but we are overstressed, overwhelmed. And that's when we need to put those coping strategies in place. Also, when we're feeling mental distress, this is a time that we often seek informal support, albeit speaking to a friend, talking to a religious leader like our pastor or our rabbi, um, talking with a coworker that we trust, sharing information with our doctor if we're seeing our doctor for another reason. So, this is when we will receive informal support for that mental distress. But again, it's being overwhelmed by our day to day events, activities, and occurrences. And we bounce back because we put our coping strategies to work and we seek informal support. So we've talked about mental health, we've talked about mental illness, and we've talked about mental distress. The last term that I'd like to share with you for today are basically mental health problems. What do I mean by mental health problems? Mental health problems are um, strong emotions that we experience that are extremely painful, and they are ongoing and long lasting. An example of such is when we lose someone we love and we're experiencing grief, and it's difficult for us to move forward with our lives. Another example would be if we're experiencing a health crisis, or if we have a loved one who's experiencing a health crisis. This is when we are experiencing very painful emotions and overwhelming stress. Stress that if this is if here this is the is where we're starting to feel stressed. Over here, we just move the needle a little bit more and we are overstressed, distressed, and sometimes approaching burnout where we're not able to do anything. So these are strong emotions. And I've used grief and I used a health crisis as an example. What tends to happen when we're experiencing a mental health problem, is that we have negative thoughts and negative thought patterns that are pervasive. If you've watched Stress Talk for a long time, you know that I've talked about our thought patterns and how our thought patterns can affect how we feel. But negative thoughts and negative thought patterns exacerbate these problems, this overwhelm that we feel, these strong emotions that we feel, this grief that we are experiencing, this health crisis that we're going through. If our thoughts and our thought patterns are negative, then it's going to exacerbate all of that. When we are having mental health problems, again, as an example, going through grief that is long term, or we have a health crisis that we're dealing with. We're experiencing difficulties cognitively in our thinking, physically in our body, as well as behaviorally in our actions. We may fly off the handle at the drop of a hat. We may be in a bad mood. We may feel depressed. We may feel anxious. Um, we may have all of these things going on inside of us that we cannot manage. And this too will cause distress, and it will affect our ability to function, not only in the home, but in our work situation as well. When we are having mental health problems like this, it doesn't necessarily mean that we are we are displaying symptoms that would lead to a mental health diagnosis. It doesn't mean that. However, formal support is indicated. You may find relief by seeing a trained clinical professional, like a therapist or a psychologist or a psychiatrist, or at least speaking with your physical doctor, your medical doctor. This formal support can help you to walk through the difficulties that you're experiencing. I do see individuals who are having severe physical conditions that they're having to manage with their medical doctor. And there's a whole mind thing about that, you all. It is. There's a mind thing around having a chronic illness that may be devastating to you. And you need to have someone you can talk to about that, someone who can share coping strategies, someone who can help you to bring the stress levels down. So, formal support when you're experiencing mental health problems, again, like grief that you're not able to move past, or a chronic health condition that is causing you to have strong emotions that are painful, formal support in the way of counseling or therapy may be indicated. So we've just gone over 4 terms all around mental health. Yes, all around mental health. We've talked about, let me go to our first slide. We've talked about mental health. We've also talked about the difference between mental health and mental illness. We talked about mental illness. We also talked about mental distress. And last but not least, we talked about mental health problems. And as you know, or as I shared with you, when you have mental distress, you have coping strategies that work for you. If you're experiencing mental health problems, it doesn't mean that you have a diagnosable condition, mental illness, but however, you could benefit from seeing a licensed clinical therapist, psychologist, or psychiatrist who can help you to get through the difficulties that you're experiencing. Well, that's it for us today. I really hope that you will join us throughout Mental Health Awareness Month. This is going to be fun for me because I'm talking about things that are very important to me, as well as things that I have learned through my training, as well as through my experience. Again, make sure that you like, follow, and subscribe so that you will get the benefit of watching and seeing all of the social media posts that we're going to share with information around mental health, as well as check us out on Let's Stress Talk Live, because we're going to have a special guest this month talking about mental health as well. Well, that's it for me. I'm Marcyline Bailey. Thank you for joining me tonight. I look forward to seeing you again soon. As always, take good care.